My name is Frederick Stein. I'm a researcher at the University of Queensland, where we work with people with MND. We have a relationship with a number of people with MND. We spend a lot of time with them. We have a lot of conversations with them. And it is through talking with these people and their families that we've realized that we may not always have all the answers, but we have one thing to offer, and that is a reminder that with MND you are not alone, and there is a research community out there that is serving you. And I think that it's with that in mind that I take exceptional pride this morning and pleasure in chairing this first session. We have 4 wonderful speakers this morning, and I'm hoping that they can give you an insight of just some of the research that's being conducted across Australia, all seeking answers that you also are seeking. So our first speaker this morning is Anjali Henders. I've had the pleasure of working with her for quite a while now. She is the project manager for SALSA. That is actually an acronym that comes out of the Ice Bucket Challenge. The Ice Bucket Challenge Consortium was established in 2015. She's also the Human Studies Manager with the Program of Complex Trait Genomics. That's a nice way of saying they study genetics, based at the University of Queensland, the Institute for Molecular Biosciences, and working alongside Naomi Ray. Anjali is responsible for the coordination of PCTG research strategy and activities, research governance, and supervision of their high-throughput genomics laboratory. And it's within this role, really, that she is exceptionally well suited this morning to give us an understanding and an idea of where the ALS Ice Bucket Challenge has taken us in terms of research. So thank you very much.
Well, thank you very much, everybody. It's my absolute pleasure to be presenting to you today and to give you an update on our SALSA Consortium project, which came about as a result of the Ice Bucket Challenge in 2014. So for those of you who know, the Global Ice Bucket Challenge was a huge event around the world. Yes, that is Carol. They're on the screen getting done. And this started in America by a young man and his family who had received an ALS diagnosis, and they really wanted to assist the ALS research community in providing funds, much needed funds, for this initiative. And so people started to douse themselves in buckets of ice and cold water, and of course we couldn't let the Americans get away with this. The Australians grabbed this opportunity, and many people around the country here in Australia took on the Ice Bucket Challenge, and together we raised over $3 million for MND research and care. The MND Research Institute of Australia then partitioned off $1 million of that money to support a major 3-year project. And they called for applications which had a specific focus on sporadic MND, but also a focus which united clinicians and researchers from around the country. Here was an opportunity where we had a significant amount of money that could be used to make real inroads, particularly into understanding sporadic MND. And so it brings me back to the very first MND Connect meeting that we had in Brisbane in 2015. It was held during the Jacaranda season, which is just ending now. And the mother of that young man, Nancy, came to Brisbane and gave us a very motivational talk about how they had reached that point in bringing together people for the Ice Bucket Challenge. And I had a lovely conversation with her. Admittedly, she had been on a plane the previous day all the way from the States, and she was very thrilled and excited that people at the bottom of the planet could come together and make inroads into sporadic MND research. She was also very impressed with how well developed Australia was and and how well we were doing for ourselves. So that was a fantastic compliment. So who are we? We are the Sporadic ALS Australian Systems Genomics Consortium, which is a very long title, but we know ourselves endearly to be the SALSA Consortium. And we're a team of established ALS researchers and clinicians in most states in Australia that have really come together to build a national platform and a national framework for making inroads into MND. So what were our aims? As I said, the call for the applications was a very specific focus, was on sporadic MND. We wanted to build an integrated infrastructure for the collection of clinical information, but also biological samples that would really complement the genomic strategy that we had. This involved coming together and harmonising clinical measures around the clinics in a set of agreed protocols, but also agreeing on what sort of biological samples we needed to collect in order to create a resource for Australia. But why was this important? We can do all of this, but what's the main aim and what is the legacy going to be? Really, we needed to, in understanding the complexity that sporadic MND is, we know that the vast majority of people who receive an ALS diagnosis, it comes out of the blue and there's no family history. MND presents in different people in different ways, and it progresses in different people in different ways. So there's a lot of unknowns out there, and this was really an idea and a concept where we could progress this. It's complex in its onset and progression, and by using standardised data collection protocols and biological collection methods, we had the opportunity then for the first time to really detect the subtle differences or the small differences between, not only between cases and controls, but between different types of cases or different patients. And we wanted to enable the clinics all around the country to have a very effective way, an efficient way of capturing data. Clinics, the medical clinics are very, very busy places, and the research clinics, in order to tap into that information, we needed to have an easy and efficient platform that was going to be able to be used. So we have come up with a protocol that is running now, and it really comprises of three components. The first is the clinical information. So we collect information on onset, the regions that are affected. We undertake the ALS-FRS each time, and we also collect a range of other measures, including ancestry and smoking status. And what's very important about this is that we collect this set of information every 3 months. Every time the patient presents at clinic, we are collecting the same set of information so that we can track and detect changes in progression every time people come in. Now, those measures that were agreed upon by the clinicians involved in SALSA, we also then talked very closely with Amanda, which is the National MND Registry here in Australia, but also with NCALS, which is the European equivalent, because we wanted to make sure that whatever we were doing here and putting into Australia was going to have synergy with what was happening overseas. We didn't want to work in isolation. I know we're at the bottom of the planet, but we have long reach and we have high impact. So it was very important to make sure that we were talking to those people. We agreed to collect a whole blood sample. It's about 30 to 35 mils, and again, we collect this every 3 months. So at the same time point that the clinical information is being collected, we ask patients to provide a whole blood sample. And it's from that where we collect the DNA that's used for our genomics program, but we also store in our biobank at IMB the plasma and the serum that comes off those samples. Now, at the moment, we don't have an exact use for those stored samples, but there are many projects that are currently running where people are looking at biomarkers, and we'd be able to have that resource that's ready to go. If people found something, we'd be able to easily be able to get those samples and actually look for those biomarkers in samples that have previously been banked and also detect. So not only is it a resource that can be taken forward and be useful for new projects, but it's also useful for projects that are currently running, because we can go back and access samples that have been collected some years ago. So it's all great to do this, and we collect samples and we collect data, but we needed an integrated platform. And I guess this was the bit that was probably the most challenging of all, is to develop a platform that not only met all the research governance requirements and the legal requirements of collecting research data, but was safe and secure enough for each independent site to be able to use it. And so we now have this system in place around the country where research teams can input patient information and clinical information very easily into this system. One thing that we're also doing, if you Google SALSA into your search line, hopefully you will come up with this page. We do have some public pages as well, where we're starting to put updates specifically about the project, just to keep in touch with everyone and provide some feedback. So this is our timeline of where we're at, and as I said, the Ice Bucket Challenge started at the end of 2014, and in May 2015, Naomi and I were in China actually forming some collaborations over there into MND research. And Naomi, as we were walking back to the hotel, it was very crowded. We were in a regional city of China of only 6 million people. But as we were walking back to the hotel, the lovely Janet Nash made the phone call to Naomi to tell her that we were successful, that the SALSA Consortium was successful in receiving that $1 million grant, and that was just fantastic news. And over the next 6 months, we then spent a long time, I spent a long time talking to many, many people working in clinics and the clinicians and the researchers about how we could put this project into practice. And I have to say that was very challenging because, as I'm sure many of you know, the models of care are very different in every state. How the clinical appointments work are different in every state. They're different between clinicians, they're different between institutions. And so to put all of that together into a standardised protocol took some time, but I have to say that we did get through there. Overlaying all of that was the research, governance and legals, and again each institution and site and hospital has their own set of lawyers who like to make sure that they put their stamp on all of those legal documents, and at the end of 2015 that was all signed off. But it is an ongoing process in order to keep this project going. So in April of 2016 we launched the whole project in Queensland, and successively every 6 months after that we've been able to bring each state online, and I'm very pleased to say that the South Australian SALSA project will be going live hopefully next week. They've just been relocated back into Flinders Medical Centre, so we'll be working very closely with David Schultz and Mari to get that on board. One of the other really important parts about this project is, and I've really emphasised the standardised protocols and what we're doing, but it's important to bring the teams together, because although I can email out protocols about what people need to be doing, the people who are collecting the data need to make sure that we're collecting that data in a very systematic and standardised way. So last year at the MND Connect meeting, all of our research nurses came to Brisbane, and we had a fun but intensive 2 days where we went through every single variable that we collect, every single instrument that is administered, to make sure that it was being administered in exactly the same way in every state. The differences that we see in the data, we want them to be real. We don't want them to be because someone was interpreting something differently. So what have we achieved? It's been a very busy 18 months. So we've built an online portal for the MND research clinics, and it's now in use at every site. We've recorded over 600 clinical appointments or 600 data collection events from 260 patients. And that's because, as I said, patients are reporting into us every 3 months. And we have completed genomic screening of the first 150 patients, and that's an ongoing process. So we can already see that SALSA is contributing and informing new research projects on patient recruitment and selection, and also hopefully will start to inform selection into clinical trials. It's provided dedicated laboratory and process infrastructure for research clinics which don't have access to the lab, and we hold that in Brisbane. Samples are sent to us via courier as soon as they're collected, and we process and store them. And we've created a national MND genomics program that not only will facilitate research here in Australia, but will allow us to communicate and collaborate much more effectively with our international collaborators. So I wanted to just give you a very quick snapshot of the cohort. As I said, we've received over 600 points of data from 260 patients, and I know this is a bit of a busy slide, but I just wanted to go through this very quickly with you. So you can see that we have a slightly higher number of males in our cohort compared to females, and I think that is consistent with this disease. Today we have over 70% of our cohort who are non-smokers. I think if this was done 25 or 30 years ago, I think the orange section would be much more significant. We collect information on people of their occupation at their time of diagnosis, and you can see we have a wide range of people from a number of occupations, who've been given an ALS diagnosis. So it certainly is. There is a broad range of activities there. And in our research day yesterday, it came up quite frequently and sort of reinforced the fact that this is a later in life disease. And so most people who would be receiving a diagnosis would be in their 6th decade of life. And again, that's consistent with the cohort that we have collected. Of course, there's always going to be extremes in that cohort, so we have collected people who have had diagnosis much later in life, and then we've also have information on people who've had an ALS diagnosis very, very early. So this, just want to talk you through this slide. So this is a bit of a summary of the biological collections that we have been amassing over the last 18 months with respect to the date of onset or the time of onset for patients. So along the y-axis, along the bottom, those bars are 6-week intervals. So we collect the date or the year or the month from which when a patient first reports their symptoms. And the bars represent how many samples we have in around for that period of time. So this sort of shows the natural disease progression and how many samples we have collected along the way. So you can see here that the majority of our samples have been collected around the 18 months after the first onset of symptoms. What we would really like to do is move that slider to the left-hand side and be collecting samples much earlier as soon as diagnosis happens. Again, from our research day yesterday, one of the reoccurring themes was that early detection of changes can lead to early intervention and certainly improve quality of life. So we have been busy in thinking about the best ways to take this project forward, and we know with MND being a complex disease, there's certainly genetic influences, but there's also environmental influences as well. And we wanted to value add to our current consortium and to the data that we've collected by collecting information from patients about their early or about their childhood, their family history, their occupation, perhaps any exposures that they've had, whether they've worked in agriculture or in mining or in the defence, and put this all together along with the clinical information that we have got, but also with the genomic information that we've been putting together. So we worked with the group at Macquarie, but also again with the European Association, the Euromotor and Sophia, to harmonise and put together an instrument that collects a whole range of information that ultimately means that we'll be able to share the data. So this is an online survey. We'll be asking patients who are currently registered in our research projects to go online and do this, and we're hoping to also make this available to people who are currently not associated with a research clinic to provide this information. It's currently in with our human research ethics process at the moment, but we're really hoping to be able to launch this in the early part of next year. So we were thinking about the whole project and what we've done and what we have achieved, and we certainly have achieved a lot in the 18 months, and I'm really proud of all the teams around the country for contributing. But there was still one part of the project that we felt where the needs were unmet, and although it wasn't a specific aim on the project, it was certainly something the Brisbane team felt very strongly about, and that was our public and patient engagement. This is a project that is entirely funded by one single community event, and so it's very important for us to be able to engage with the patients and with the public, firstly to let them know how the project is going, but to involve them in research much more actively as well. And so we had a bit of a brainstorm in Brisbane about how we could do this, and there was a number of other initiatives that are in play at the moment as well to really think about what is the best way that we can do this. We have an online system, we have a portal for research clinics. Perhaps we could add to that where patients could be engaged with, or patients can report information back to the clinic or back into research projects that again would add value to the data set that we're currently creating. And so we came up with the idea of an app or some kind of interface that would really empower patients to take control of their MND diagnosis and track their progression. And it's a great idea, but how are we actually going to do that? And this is a really huge task. We're all researchers, and although we do have teams of people who are statisticians and computational analysts, slightly different skill sets. So in my mind, it was going to be a 3, 4, 6 month project that we would be able to show hopefully this time next year. But we were very fortunate in that there was an event being held around Australia and also in Brisbane called a Health Hack. And this is where people who come from computing backgrounds, so gamers, illustrators, software developers, computer scientists, voluntarily give up their time for an entire weekend to solve health problems. And so we pitched, the MND Queensland team pitched at that, our idea to try and develop an app that would engage patients to provide information on their symptoms. And so we went up against 7 other teams. We did bribe with Tim Tams and lollies and Chubba Chubs to get people through the weekend, which I think worked because we ended up with the biggest team at the end of the evening. And in fact, we had to actually give some of our team members up, which we weren't so happy about. But over the course of that weekend, over 28 hours, we went from an idea on paper to an app that we can, a prototype of an app that we can download. Now, we also understand this is not going to be a tool that is suitable for everybody or appropriate for everybody, but this is a launching pad for this. This has forced us to really think about what is important to patients, including the carers, talking to the support services and the other volunteer groups around the country about what's really going to make this work and what do people really want. And that's a process that we're just at the beginning of. But I wanted to share this with you because I do think it's an important initiative. So this was the pitch that we gave, and I'm very pleased to say that after the 28 hours, we came up with a prototype. So we have a front screen where there'll be information about MND in your local state. You will create an account the same way that you create an online Woolies account to get your groceries delivered. It will collect information. There is a calendar. It can remind you of your appointments. But most importantly, every 2 weeks, it provides the opportunity for patients to report directly in real time to our SALSA system on their symptoms. But it's quite a holistic view. So we're also asking questions about people's mental health, about their appetite and their diet, as well as the clinical information that would normally be reported at your appointment. So the plan would be is you would be presented with an image like this man here, and you would click on your particular region that may be affected, and you would report using quite a simple slide scale to report on your symptoms for that day. The idea is to give you a snapshot today of how you are and how you have been, and also then provide you with, and I haven't shown that here because it's still in development, is to give you an idea of a comparison as to how you were going over the last month or over the last 3 months. The idea of the app is also to be able to produce an output for you to take to your clinician or to take to your health professional team. So, because these appointments are really short, so it means that you won't forget to say anything and you'll have it all there for you. So it really is just a working prototype at the moment, but we will be engaging with many of the support services and patients themselves to get feedback into how this will progress. So in thinking about this talk today and sort of bringing you up to speed on the SALSA project made me think all the way back when to 2014 and how important that single event was. And I was standing at the school gate talking to the other mums saying, do you remember the Ice Bucket Challenge? And of course they did. I think we all did it as a group on the Oval. But the most important thing that came out of that conversation was they remembered that it was for MND research. And I think that's the enduring legacy. Not only was it a global event that was fun and it joined communities, but actually has now been strongly associated with MND research. And it's still, and it's, you know, its profile not only in the medical literature, but also in the community. And I just wanted to alert you to, this is a Nature journal that just recently put out a special edition on ALS. And so what I really want to leave here today is to say that it's been an absolute privilege to be part of this project and to get this project out into Australia. And I really hope that it has an enduring legacy, just like the Ice Bucket Challenge. So there are many people involved, all of the clinicians and researchers around the country. Most importantly, I'd like to thank all the clinical and research nurses at all the sites where we are. These are the people who talk to you, who phone you up, who make sure you're okay, keep your appointments. And I have a wonderful team of laboratory and IT staff at the University of Queensland who've really brought this together. And I'd like to thank all of our contributors and sponsors. So thank you.